where people could change jobs, start businesses, become self-employed, whether they pursue their artistic aspirations or be entrepreneurial and start new businesses, if they were not job locked because they have a child who's bipolar or a family member who's diabetic with a pre-existing condition, and all of the other constraints that having health care or not having health care places on an entrepreneurial spirit. Think of an economy with that dynamism of people following their pursuit.
So let's look at the facts a little bit more, because they can be stubborn, you know. Harvard just completed a study that shows 45,000 Americans die every year because they don't have health insurance. Almost 1,000 a week in America. In 2008, about 750,000 bankruptcies were filed. About 70% of those bankruptcies were filed because of health care costs. 80% of the people that filed for bankruptcy because of health care costs had health insurance. America is the only country in the world where if you get sick or hurt, you're going to have to file bankruptcy. 750,000 bankruptcies in 2008. These facts show that the story that I told about Jesus is not just a story of some young businessman in Reno, Nevada running a restaurant that gets jerked around by an insurance company. Happens all over. Health reform shouldn't be about political parties fighting each other. It should be about people fighting for their lives.
Christmas Eve. And more importantly, we want to make that our goal, reducing healthcare costs.
We could come to an agreement on probably 8 or 10 common sense steps that you outlined to make our healthcare system better.
Thursday, actually, to display some of our brightest, most knowledgeable Republicans. I thought it was actually very good for us because it certainly refuted the notion that Republicans are not interested in this subject and not knowledgeable about it and don't have alternatives. And we laid out a number.
We are basically including most of those provisions, if not all, in our joint legislation. Selling insurance across state lines, for example, we allow for that, not exactly in the way that some would, but sure, with compacts, and once the state exchanges are up, people will be able to buy and sell insurance across.
Did I get that wrong? And there are in every state. And so what we're simply saying is, look, lots of us have offered lots of different ideas. We've got dozens of Republican ideas offered in the House and bills in the Senate.
By the Republicans. We actually agree with the idea that maybe if you get more regional markets and national markets as opposed to just state-by-state markets, you might get more choice and competition. People would be able to say, gosh, there's a great insurance company in Nevada, and I live in New York, and maybe I can purchase it. That's actually something that we find attractive. So do you guys. But again, the one difference, as I understand it, and the reason you're not supporting the approach that we take is, what we say is there should be sort of a minimum baseline benefit, because if not, what ends up happening is you get a company set up in Nevada, let's assume there were no rules there, there are no protections for the woman who's got breast cancer. They go into New York, they offer pretty cheap insurance to everybody who's healthy. They don't offer the same insurance to people who aren't so healthy or have pre-existing conditions. They drain from New York all the healthy people who are getting cheaper rates, but now suddenly everybody left in New York who doesn't qualify for that cheaper plan is in a pool that's sicker, older, and their premiums go up. So what we said is, well, if we can set a baseline, then you can have interstate competition, but it's not a race to the bottom. Rather, everybody's got some basic